from Vet Triage. We are going through Veterinary Surgery, April 2022 edition. We're going to talk horses today. The failure mode of a mechanically loaded equine medial femoral condyle analog with a void and the impact of lag and neutral screw placement. So this already has a lot of words to it. So let's just go through some things. This comes out of Kansas State University and the Ohio State University. So first off, the equine medial femoral condyle, so that's right above the hip joint. Condyle analog, meaning a fake disc that they're going to use. It's in this picture here. This is the discs. And then with a void, the void is this hole in this. They place a hole. That's supposed to resemble the subchondral lucency of the medial femoral condyle in a horse. And then the impact of lag and neutral screw placement. You can see a screw head here. They place a screw, and you can see the threads of the screw just right there on the edge. And so that's what they're studying here. When they talk about lag and neutral screw placement, this is lag screw placement. So if you notice, if you normally place a screw in a bone, if you drill at the same diameter, then the head of the screw, which is going to be bigger in diameter than the body of the screw, is going to stick out the bone. And that's called neutral positioning. That's you just placing the bone screw. We do this a lot, and it looks like it's a warning sign here, but this is just showing you the difference between neutral placement and lag placement. Lag placement, you over drill the initial part of the path, and that allows the screw head to sink in. This creates a lag. They call it lag compression. And what the difference is between the two forces is lag ends up compressing the fracture ends more, whereas neutral opposes them but doesn't cause compression. And there's pros and cons to both, but that's what they're testing here. They're testing a void in a fake bone, and they're placing screws in lag fashion and neutral fashion and comparing them. Objective is to determine the failure method of simulated equine femoral equine medial femoral condyle subchondral bone defects under compression and the influence of screw placement. It's in vitro study. They use composite discs. That's these discs here. 4 discs were used, all with a 12.7 millimeter void. That's this part. They had an intact, meaning no void, disc. They had a disc with a void only. They had a disc with a void and a 4.5 millimeter screw placed in neutral, and then a void with a screw placed in lag fashion. Results found the specimens failed by cracking at the superior aspect of the void. So superior aspect is this part here, or the screw exit hole, which is so that the screw is exiting here. Then that's where they're seeing the cracks happen. Displacement at peak load was 0.06 millimeters for intact discs, 0.32 millimeters for void, 0.24 millimeters for a void with a lag screw, and 0.1 millimeter for a void with neutral screw. Conclusion is that these model discs failed by superior cracking that was resisted by lag and neutral screw placement. Neutral screws may be an acceptable treatment method for subchondral lesions of the medial femoral condyle. So meaning that it's better to have a screw versus not having a screw, and both methods are fine. Introduction. Subchondral lucencies are seen commonly in young horses of the medial femoral condyle. Screw fixation is intended to provide mechanical bone stimulus and stimulate bone healing, eventually eliminating lameness. Success rates after surgical debridement vary depending on the definition of success and duration of follow-up, but they have been generally increasing over the last 40 years from approximately 50% with rest alone to 70 to 80% after more invasive treatments. Materials and methods. The bone analogs were two component composite round discs with a 35 millimeter outer diameter and 15 millimeter thickness. The central trabecular bone analog was pound 30 polycarbonate open cell foam, and the outer cortical analog was a short fiber filled epoxy. The foam density and cortical thickness were chosen based on the measured bone density in Hounsfield units from computed tomography CT scans of the stifle of a young yearling thoroughbred, and the geometry estimated at a frontal plane slice of a yearling medial femoral condyle. Meaning that they made this based on a CT scan of real horses. For mechanical testing, for cyclic testing, the load was selected because it did not result in cracking of any disc condition in the first 100 cycles. It did cause cracking in some after 10,000 cycles, which is in the range of the number of steps taken by a yearling during 2 weeks of post-operative stall confinement. With regards to monotonic testing, the discs were preloaded to 20 newtons, followed by linear ramped compressive loading at 20 newtons per second to a maximum load of 6,000 newtons. Failure was defined as cracks in the disc, which is the result of material failure and are the most common outcome measure of trabecular bone failure. Cracks were located in 2 locations. One is superior, and the other is in the epoxy shell at the screw exit hole, and included delamination of the exterior shell from the polycarbonate foam. Here's an example of how they put the disc into the machine and put it through testing. And then this is a close-up of the picture you've already seen with the different screw placement. Okay. Results. Cracking of composite discs and monotonic data. The disc cracking occurred in 2 locations, superior and at the tip of the screw. For the mean load at first fracture under monotonic loading to 6,000 newtons, treatment with a neutral screw resulted in a large difference compared to no treatment, so screw better than no screw. There was no difference between the 2 different screw placements. Regarding displacement after cyclical testing, no specimen reached failure displacement of 4 millimeters after 10,000 cycles. Mean displacement under quasi-static loading of 2,000 newtons for the intact disc was 1.12 millimeters. For the void was 1.63 millimeters. For lag screw, 1.7 millimeters. Neutral screw, 1.27 millimeters. The intact disc differed from the void-only disc and the lag screw disc. There was no difference between the intact disc and placement of neutral screw. There was no difference between the treatment groups of lag and neutral screw. Discussion. The intact disc under compressive loading had the greatest resistance to failure, meaning cracking, and displacement at peak loads of 2,000 newtons after cyclic testing. The void-only discs had the least resistance. It is evident that voids reduce the compressive strength of the disc and decrease resistance to cracking. The macro cracking at the superior aspect of the void in the model supports the existence of tensile forces in this location. Similar to foam cracking, bone damage at the superior aspect of the subchondral void may contribute to the formation and persistence of bone voids in the horse. Microcracks are the failure mode of trabecular bone under testing. These smaller cracks in the trabecular bone at the void margin may contribute to subchondral lesion formation. Adding a screw to a disc with a void results in increased mean monotonic load to the first fracture for lag and neutral screws, but only the neutral screw was statistically different from the control, meaning void-only discs. Contrary to the expectations of the study, void lag discs were not better than neutral screws. Under cyclic testing, the void screws did resist failure better than void only, as they did not crack. This suggests that the engagement of more bone material with a neutral screw is better than a lag screw in resisting cracking in voids under compression. Neutral screws may create a more stable construct, engaging bone on both sides of the lesion compared to a lag screw with an over-drilled glide hole on the near side of the lesion. Although not measured in this study, it supports the conclusion that compression can be generated by a neutral screw in some types of bone, although there could be other factors. That's it. Pretty straightforward study, cool stuff. And hopefully they'll apply it eventually to real horses in real clinical settings, but this is a good first step. Thanks for supporting the channel, everybody. We'll see you again tomorrow. Bye-bye.